Dr. Scott Fuller. On this video, I want to talk about how you can strengthen your immune system, which may help you with outcomes of viruses, flu, coronavirus, and SARS-CoV-2 exposures, maybe. And to understand that, I want to talk about what's right off the CDC website. Underlying conditions that affect flu, which are viruses, including coronavirus, SARS-CoV-2, and so forth. So these worsen outcomes. Smoking, high blood pressure and heart disease, obesity, more on that in a moment, renal disease, diabetes, and cancer. Also, people who live in nursing homes and long-term care facilities, and we know this with the terrible news that we have now. So if we address those underlying conditions and you can get started right away, then you can improve your chance of getting through viral exposures, flu exposures, coronavirus exposures. To understand the effects of these risk factors, let's look around the world at what's happening now. Some of what I'm talking about is from PeterAttiaMD.com, his podcast, and he interviewed on March 31st Michael Osterholm, who is the director of the Center for Infectious Disease Research and Policy at the University of Minnesota. They had a great discussion on a lot of challenges that we're facing right now. So navigate your way over there if you want to do a deeper dive on some of the things we're talking about. In China, the case fatality rate by age differed from males to females. There was a high rate of significant illness and death in males over age 65, but almost 70% of males over age 65 in China smoke, where only 2% of women over age 65 smoke. So that's a significant risk factor and a difference in outcome. Essential hypertension is another risk factor they were talking about. And obesity is highly associated with bad outcomes. Now, obesity is rare in the older population in China, but much more common in those under 30 in China. When you fast forward to the United States, the data coming out of New York, particularly New York City, there's an increased number of severe illnesses and death in people between the ages of 25 and 50. Well, why is that? They said almost to a T, the risk factor is obesity. 45% of our population in the United States over 50 is considered moderate to severely obese. And remember, you can start turning that around today if you fall into that category. Renal disease is associated with bad outcomes they were talking about. 700,000 Americans have end-stage renal disease. When you add up all these comorbidities that are unique to the United States, in a large part due to our lifestyle, we don't know what it's going to do, coronavirus that is, SARS-CoV-2 in the United States. Now, a couple of other countries to look at. In South Korea, the case fatality rate was about 1%. But keeping in mind, the initial big outbreak was a religious sect with a mean age of 43. Comparing that to Italy, 80% of cases were those over 80, and many of them had underlying health problems. And in Italy, there was an 8% case fatality rate, or 8 times that of South Korea. But you can see how those outcomes became different and why. Another thing, in China, there's really nothing in the air called nursing homes and long-term care facilities. Older people just stay home with the family. In the United States, they said, quote, "We're sitting on a powder keg," close quote, with nursing homes and long-term care facilities. And unfortunately, we're starting to see that. We are a population that is highly vulnerable because of all the lifestyle and health conditions that occur in our group. And then they were discussing, well, what are we going to do about that? We have to suppress the transmission as much as we can, but the difficulty there is we can't shut down our communities like they did in China. We just don't have that ability, so we're doing the best that we can. In that interview with Peter Attia and Michael Osterholm, they also talked about the critical drug shortage we may face because of supply chain. 85% of the drugs that we expect to be there in a hospital are produced overseas. And they also spent a lot of time, how do we protect our healthcare workers? So they talked about, again, supply chains and PPEs and so forth, and what we're going to be doing there. Okay, so we have the risk factors. What do we do now for yourself, for your family, to strengthen your immune system and give you the best chance of a good outcome when you do get exposed? 6 things. Number 1, diet. Eat the cleanest diet that you possibly can this point moving forward. The cleanest diet you can. There's plenty of information out there. I think most people know what to do. Increase vegetables and decrease sugar and processed foods would be a great thing. Don't drink any calories, meaning no soda, no diet soda, no juice, and drink enough water. More on that in a second. Number 2 is exercise. Try to exercise every day. Exercise to your ability. If you have a chronic health condition and you're on medications and you haven't exercised for a while, check with your doctor first, probably virtually, probably with a telephone, telehealth visit before you start exercise, right? Number 3, now spine and nervous system. Spine, nervous system, and chiropractic could play a role here as well. We know that people under acute and chronic pain, that it keeps your stress chemicals up, decreasing your immune response. Chiropractic has shown time and again to be very good with people with pain. So just some articles here I want to buzz through on the role of chiropractic there. And I've covered these in other videos as well. A couple of interesting ones on chronic spinal pain. Chiropractic went against Celebrex for chronic low back pain. That was out of Spine magazine in July of 2003. And chiropractic was better than 5 times more effective than Celebrex for dealing with chronic low back pain. A year later, in another journal, that group was followed up, and there was good long-term effects on that chronic low back pain group. In the Spine magazine in 2012, there was acute low back pain where chiropractic was compared to diclofenac, and anti-inflammatory chiropractic did better. This is important. We have 2 very good studies showing that chiropractic care of the spine can decrease blood pressure. One article out of the Journal of Human Hypertension, March of 2007, where it talked about Atlas readjustments and alignments. Just one. And it wasn't even manual chiropractic adjustment, it was light force. One adjustment reduced blood pressure for 8 weeks, as good as the typical 2-drug therapy for high blood pressure. That's important. Second high blood pressure article was out of the Asian Journal of Multidisciplinary Studies in 2015. One adjustment to the upper back area compared to a group that had a fake chiropractic adjustment and a group that had no chiropractic adjustment. Only the chiropractic group reduced blood pressure. And again, it was instrument, not even manual adjusting. Another article of Rehabilitation Research and Practice in 2014, effects of thoracic adjusting on heart rate variability and pain in women with fibromyalgia, showed a decrease in pain, improved heart rate variability in women after that. Again, heart problems being a risk factor in fighting off viruses. Chiropractic adjustments for the care of children with otitis media was an article back in 1997. Why do I mention that? Again, that's suggesting some influence on the sympathetic nervous system and maybe the immune system with chiropractic adjusting, and of course that was 23 years ago. Metabolic changes in brain metabolic changes in men after chiropractic adjusting for their neck problem. That was in the journal Alternative Therapies, Health and Medicine in 2011. When you improve the blood flow to the brain after working on the spine, better brain, better everything. Here's another article, adjusting of spinal joints affects sensory motor integration of the prefrontal cortex. Wow, what does that mean? Work on the spinal joints with chiropractic. It increases plasticity in the brain. That was out of Neuroplasticity in 2016. So there's a lot of suggestions of better spine, better brain, better physiology, maybe giving us a better chance of a stronger immune system to give us the best chance. So number 4 is reducing stress, right? Do all your stress-related techniques. Now that we're all stuck at home, get your kids involved. Maybe teach them mindfulness, meditation. Later on down the road, if you can engage in acupuncture, massage. At home, you can do Qigong and Tai Chi. Introduce the kids to it. Just a couple of minutes a day. Get the ball rolling. Maybe otherwise they wouldn't get exposed until now. Reducing stress. That's great. Number 5, water. Most of us are not drinking enough water. Again, if you have any sort of disorder, medications, kidney problems, blood pressure trouble, or whatever, check with your doctor before you start amping up your water. But most of us are going to do pretty good. Again, check with a healthcare practitioner. Pretty good with half your body weight in ounces per day. That scares a lot of people. Don't load up with water at night. Drink most of your water first thing in the morning and then in the afternoon, and trickle that down at night so you don't have to get up and pee as much. And then immune system supplementation, right? Plenty of literature on vitamin C. More literature is coming out on zinc. Omega-3 fish oil, antioxidants, there's different herbal concoctions and so forth. So consider those things. Strengthen your immune system. Give ourselves the best chance. Most of us are going to do just fine. Let's help each other. And remember, stop flushing wipes down the toilet. I'm Dr. Scott Fuller.